Good evening and welcome to our advocacy event. I am Aileen Cassida and I am the president of the Farmville VNA chapter. I am so pleased to welcome you tonight to tonight's event as we're discussing nursing legislative priorities for 2024 and provide an opportunity for our legislators, their staff, legislative candidates, participating nurses, and nursing students to get better acquainted. I'd like to begin by introducing Central Virginia's President June Knoll, Government Relations Chair James Gill, and Government Relations Chair, Co-Chair Melissa Early. I'd also like to introduce our VNA Board Commissioners on Government Relations, Ashley Apple, who is the integral to our advocacy program and will be chiming in from time to time. A brief reminder that, as is our standard practice at all events, we kindly request everyone to adhere to the code of conduct, which is visible on your screen. At this time, please turn on your webcam so that we can see you all, but please be sure to mute yourself. If there are any leaders of other nursing associations or organizations in attendance tonight, would you please unmute and briefly introduce yourself?
Hi, this is Janet Short. For some reason, my video is not working, but I'm the one that says owner. I am the president of the AORN Richmond chapter 4702.
Thank you. In just a moment, we're going to briefly get to know our legislative guests, and afterwards we'll dive into 2024 public policy platform for nursing. We're looking forward to some healthy discussion about the issues. You'll be able to enter your questions and thoughts in the chat feed throughout the evening, so please have your chat box open, ready to go. All right, legislators and candidates, please unmute, and when we call your name, take a moment to introduce yourself and tell us how many nurses you have in your family, because most of us all do. We will have an opportunity to hear more about your legislative priorities and work a little later in the hour.
I'll kick things off. I don't think we're a shy bunch here, but I'm Senator Ghazala Hashmi, and I currently represent Senate District 10, which is a good part of the city of Richmond, Chesterfield County, and all of Powhatan County. I'm running for re-election in Senate District 15, the newly drawn Senate District 15, which is Southside Richmond, as well as Chesterfield County. And I don't think I have any nurses in my family. I was trying to think when you said that. I don't believe I do.
You're one of the few.
I'm sorry.
We won't count it against you, I promise.
Okay.
Hi, I'm Deborah Gardner, and I am currently running in the House of Delegates running for the House of Delegates in the 76th district, which is newly drawn, and it's an open seat. I have one nurse in my family, and quite a few CNAs though. So yeah, thank you for having me this afternoon.
Good evening, everyone. It's nice to see lots of you again. I'm Carrie Coiner. I represent the newly drawn 75th district. It used to be the 62nd. I do have the Tri-Cities Hospital, which is formerly known as John Randolph Hospital, in my district, as well as standalone ER. I have two nurses in my household. My mom, she was a cardiac cath nurse. So the last portion of her career at John Randolph Hospital. And before that, she was at Chippenham Hospital, where she worked in the same unit. And then my youngest sister is a nurse on the palliative care unit at VCU. She's also their team lead for all things spirit and birthdays and rocking out trying to win the competition with bulletin boards in the hospital. So go palliative care unit. And I represent southern end of Chesterfield County, the entire city of Hopewell, and about 30% of Prince George County, including Fort Gregg Adams. Great to be with you all tonight.
I guess I'll go next. Nathan McKenzie. I am your candidate running for State Senate District 12, which consists of the other part of North Chesterfield that Gonzala doesn't touch, goes far north is Bon Air, and as far south as Matoka, Ettrick. And we also have the entirety of Colonial Heights as well. And as far as nurses are concerned, my aunt is a nurse. My cousin is an aspiring nurse. And we have a couple other medical professionals, admins in the field too as well. And my wife, she is a medical health professional in that sense, works with Anthem Blue Cross Blue Shield. So I hear all the jargon. I'm still trying to figure out the lexicon of all of it. So yes.
All right, I'll speak up next. Good evening, everyone. My name is Bilal Z. Ray Shuni. I am running for the House of Delegates in the newly drawn District 72, which includes the Midlothian part of Chesterfield, as well as the entirety of Powhatan, Amelia, and Nottoway counties. As far as nurses go in my family, I have one. I have one nurse in my family. My aunt on my father's side, she lives and works in Australia, in Melbourne, and has been a nurse, has been working in the medical field since the late 80s, when she and my brother left Lebanon. Lebanon was at the height of a war at the time, and they both went to two different parts of the world trying to make a better life for themselves. My father came here to the States, and my aunt went to Australia, and she's worked in medicine in Australia since then.
Thank you all. At this time, I would like to turn it over to our Central Virginia Government Relations Chair, James Gill, who will discuss the Virginia Legislative Nursing Alliance and the development of the public policy platform.
All right, thank you so much. So, first of all, just would like to say good evening to the legislators and candidates. We know you have a lot of busy months ahead of you as we prepare for upcoming elections, so we certainly appreciate you making time to come and join us and hear what we have to say this evening. So I'll go ahead and get started, and then we'll pause for questions and things like that throughout. So there are 120,000 registered nurses in Virginia, which translates to about 1 of every 72 Virginians being a constituent of yours. Pretty significant numbers. So imagine you're well aware of the toll the pandemic took on nurses, as well as health systems where many of the nurses work. The issues that we want to discuss with you, which are our priorities, while they were exacerbated by COVID, have challenged our profession and communities for far longer. In recent years, the VNA has spearheaded the creation of the Virginia Legislative Nursing Alliance, which is composed of leaders from nursing specialty organizations throughout the Commonwealth. I'm excited to say that the VLNA continues to grow in size and engagement, with about 20 organizations participating this year. One of the outcomes of the group is the creation of our public policy platform for nursing. Our 2024 platform focuses on 3 crucial areas: strengthening the nursing workforce, increasing access to care, and advancing full practice authority. Our first focus is on strengthening the nursing workforce, which includes 3 primary areas of emphasis: ensuring safe staffing and promoting workplace safety, investing in nursing programs, and growing the workforce. If nurses are to meet the needs of patients, urgent action is needed to protect and preserve our workforce. Inadequate staffing is a long-standing problem that dramatically worsened due to the COVID-19 pandemic, and it poses a threat to patient safety and the sustainability of the nursing workforce. When hospitals and other practice settings are inadequately staffed, nurses work longer hours and are assigned excessive workloads, making it difficult or impossible to provide the high-quality care that our patients deserve. This causes significant moral distress and job satisfaction among nurses, which often pushes them away from the bedside or out of the profession entirely. As demands for care continue to increase, we cannot afford to lose any more nurses. Nurses deserve to feel safe in their workplace. Violence against healthcare workers is rising in hospitals across the nation, And because nurses spend more time with patients than any other healthcare professional, they are the most likely to be victimized by verbal abuse, physical violence from patients, families, visitors, and others. Workplace violence and other hazards that threaten their health and well-being of nurses, such as the presence of surgical smoke in the operating room, must be mitigated immediately. So let's shift our discussion for a moment to talk about unintended medical errors. Our healthcare system relies on the concept of a just culture, that is an organization-wide mindset and process where mistakes or errors do not result in automatic punishment, but rather a process to uncover the source of the error. When an error is made, healthcare facilities rely on clinicians to voluntarily report the error so that the root cause analysis can be performed and future errors can be prevented through system change. If clinicians fear criminal prosecution for voluntary disclosure of a medication error, they will be much less likely to report these errors, and this will allow system failures to go undetected and uncorrected, ultimately making patients less safe. It is vital that we preserve just culture as a means to protect patient safety. A voluntary disclosure of an unintentional medication error should not be used criminally to prosecute any clinician, but there are currently no legal protections in place for clinicians in Virginia. One of the significant challenges to the nursing shortage is the inability of our academic institutions to admit more students into their nursing programs due to a lack of nursing faculty and clinical sites. The current and projected need for nurses is significantly larger than our capacity to produce them. We are certainly thrilled with the millions of dollars our governor and legislators have used to fund education initiatives over the past year. To produce enough nurses to meet the demands of an aging populace, sustained increases in funding would be necessary. This includes investing in nursing faculty to make wages more competitive with clinical practice, funding preceptor incentives so that schools can secure additional clinical sites. We should also increase funding for programs that incentivize students, particularly the Earn While You Learn program. Investment should support nurses' efforts to diversify our pool of faculty and students so that our future nursing workforce better reflects the communities that we serve. So at this time, I would like to invite any thoughts or questions about any of the issues that have been raised so far. And I do have a couple of questions from members that were submitted prior to the meeting. So if you don't have any questions at the moment, then I can certainly ask the member questions and then we can move forward from there.
And I don't see any questions in the chat at this time.
Okay.
Can I comment?
Apologies.
I'm sorry. Is it okay to make some comments on what you presented, James?
Certainly.
Well, I really appreciate the overview, and I know how very, very concerning the staffing shortages have been all across Virginia, and I'm certainly very concerned about workplace safety issues. We've seen escalation of violence against our clinicians in our hospital settings, and anytime I talk to folks in the profession, this is one of the top concerns. But wanted to share a little bit about what I did a couple of years ago in an attempt to begin to address these workplace shortages and to support more students going through our programs. I'd worked with our community college system. We'd introduced a fairly comprehensive budget bill to expand our clinical sites, to bring more nursing faculty into our community colleges by increasing pay and some incentives for them to join the faculty. That was a pretty concerted effort to expand the funding, to get some supports and open the doorway for more students to be able to access these programs. Unfortunately, we had some serious challenges and obstacles, mainly from our four-year institutions. I think there are ways to continue to work on that, to have collaboration and discussion. And I certainly hope now, as we introduce the new biennium budget, that we will be able to revisit those efforts and I'm really, really interested in working closely with our community colleges in particular to open up more pathways for more students to go through these programs.
And thank you so much for all of your support. It's tremendously appreciated. We are thrilled to be able to continue working with you. And I see that, let me see, I think there was a hand up. Is that Stephen?
Yes, good evening, good evening. Stephen Miller Pitts. I'm running for House of Douglas, District 75, Southern Chesterfield County, Hopewell and Prince George. Excuse my tardiness. I was on another call trying to hop to this call. And I do have a family full of nurses. My aunt, my favorite aunt, she's getting ready to retire after almost 35 years as a nurse. My cousins have followed suit. My wife's family, her closest cousins are currently traveling nurses. So I'm a staunch supporter. I'm currently also a professor at Virginia State University. Virginia State has a nursing program. And so I'm very involved on campus with ensuring that students understand their responsibility in maximizing these type of opportunities. So I would love to be able to help facilitate some of the growth in the nursing programs. And obviously, Virginia State being a HBCU, it would definitely help with diversity. Not saying diversity is an issue, but a majority of the students that attend Virginia State University are people of color. So in that program, getting more resources from the governor, because Virginia State is a state school, right? And being able to do other things as a military veteran, working in different companies that have similar nursing type specialties. Ensuring the safety and promoting workplace safety is definitely something that I want to champion with our first responders, and me being a veteran, just knowing that we have a job to do. And we just want to do the job and go home to our families, right? And so definitely a strong supporter of strengthening these priorities for the nursing workforce.
And thank you both for speaking to the issue of workplace violence. That has been, as you both recognize, a huge struggle. It was bad before COVID, and the additional stress that everyone has felt through and since COVID has just exacerbated the issue. So we know it's not an entirely legislative approach, that it's got to be multi-pronged. And we're working on different efforts, but we thank you for all of your support in addressing it in multiple ways through the legislature.
Alrighty. Were there any more hands or comments, or I'm trying to peek?
I see Bill has his hand raised.
I think that's Bilal.
I'm sorry, it disappeared from my screen before I could read the full name. Bilal, I apologize.
It wouldn't be the first time. You're fine. Yeah, no, listen, there's not a single thing that's been said so far that I've disagreed with. I mean, the importance of the medical, like the importance of having our medical staff, our RNs, our medical practitioners cannot be understated, not just from a post-pandemic, if we can even still call it a post-pandemic response, but in general, so as a teacher out here in Powhatan County, I have a lot of students who actually just today we were talking about. I teach computer science, but we were working with our STEM department, talking about how we've had all these advances in technology and all these new machines and these new AIs that are being brought into the hospitals, into the workspace. And one of my kids' biggest concerns, I had one brilliant student who asked me today, is there still going to be a need for people in the field? And I said, absolutely. Machines are only as good as the people who program and the people who use them. And there's not going to ever be, we are never going to get to a point in medical practice where a machine is going to be able to do what a person does, at least not as effectively and not with as much intuition and with as much heart. So ensuring that we are securing safe, hospitable environments for our RNs and for our doctors and for our medical folks is absolutely vital. But that also brings me back to a conversation that I had with somebody a week ago. It was my doctor's wife. So here in Powhatan, she runs a clinic in Amelia, and she had lamented that, once you start getting out to the rural counties, which I do represent, there is it's not a steady decline. There is a sudden drop off in availability of medical practitioners. Like, and that's so when we discuss medical access and equitability across the medical field, we need to, like, that includes, do our further out populations in these small towns and in these rural areas, are they going more than an hour or so to reach a qualified professional, or even to just get to the emergency room? Or do they have to be medevaced, out because they're simply too far away to drive there realistically? So there's definitely a balance that can be struck between increasing the presence of medical facilities where they're needed most, while also ensuring that we're not stretched so thin that it already exacerbates the kind of stresses and workplaces and workplace hazards that we are seeing with a lot of folks who are already there, because that is the last thing that we want to do. We want to be able to provide, but we don't want to strain the resources we already have. So yes, I am already all for everything that we're talking about, getting more funding put into our medical practices, making sure these facilities are safe for everyone. These are steps in the right direction to make sure that everybody can get the medicine they need when they need it, while taking care of the providers.
Thank you. I appreciate your comments. Jim, I know that we have, or James, I know that we have candidate Mackenzie, and who had raised their hand. And then we would also love to ask Janet Short with AORN to speak a little bit about the surgical smoke issue.
Thank you, Janet. I wanted to let everyone know, when you hear surgical smoke, if you're not aware of what's going on in the OR, you're thinking, well, why are they smoking in the OR? So surgical smoke is generated by our electrical cautery systems and laser systems. And what happens is the energy goes into the different layers of the body and smoke comes up. You can visually see it and you can smell it. And for many years, it has been documented that this surgical smoke does have droplets of various viruses like HIV and HPV. It also has carcinogens, formaldehyde, benzoins, all different types of chemicals. And this past Monday night, we had the OR director from Cleveland Clinic to speak to us at our AORN monthly meeting. And he is a registered nurse, but he's also a firefighter. And he was able to parallel the sameness of, look, firefighters wear all this equipment when they go into a toxic environment with fire, and yet our perioperative staff is actually smelling and inhaling this surgical smoke. And so why aren't we taking measures to be able to have a safe environment for everyone in the room? We had one of our medical representatives to bring the actual bovie and suction. And when she turned the suction off, smoke was just a small amount of smoke was in that room and everybody smelled it. And she said, and this is what our nurses are being exposed to. Not only nurses, surgeons, patients, anesthesia providers, anyone who is in the room is exposed to it. So I wanted to let you know that as of right now, 15 states have passed a surgical smoke law and 8 states are pending. And our chapter, Richmond chapter, is working very, very hard with National AORN to be able to introduce a bill for 2024 to be able to have this law for the Commonwealth of Virginia. We feel very, very strongly that this is a safety issue. Two people from the government were with us on Monday night. Garrison Coward, who is the senior advisor for our governor, as well as Arnie Owens, the director of Department of Health Professions. They were both there so that we could educate them on what this surgical smoke is and that they would know what it is once we begin to do this process. And I just want to make everyone aware, this is a safety issue for nurses, for all perioperative people, but also as patients, because as someone brought up, we do a lot of local cases where we're just doing local anesthesia. So that patient's lying there and they're smelling the smoke. So I just wanted to let you know that this is probably going to be an issue that you're going to be able to see in the next few months. Hopefully, we're going to go to Nashville next year for the national conference, and we have from St. Mary's Hospital, we actually won the Go Clear Award, the gold level, which is when you submit a great deal of documentation and you have the equipment to be able to evacuate smoke, which is what St. Mary's Hospital did. And we have going to present a poster to the national conference, and we're calling it the Journey to an Smoke-Free OR. So we're very proud of our committee and our chapter to be able to stand behind this. So I just wanted to let you know you're going to start seeing more and more of this because we're really, really pushing for it. Thank you for your time.
Thank you.
I think candidate Mackenzie had their hand up.
Yeah, thank you so much, Janet. And also thank you for educating us about surgical smoke. Because, I mean, if I walked into a emergency room, I saw that going on, I'd probably run for the door versus asking what that's about, right? But in that conversation about just kind of OR safety or just safety in general, you alluded to what just culture was earlier and how that affects folks when it comes to them practicing and developing in their own craft, right? Because there's a point when nursing turns into an art versus a science, I would argue, right? When you start to really get into the groove and understand exactly what you need to do. I can't tell you how many times somebody poked me to get my blood versus that one nurse who got a little bit more experience to come in and do that one time. But if you could elaborate on what that just culture would look like and how we might be able to help facilitate that, I think that would be helpful.
Sure, I'm happy to jump in because this is an issue of personal passion for me. So, just culture is a readily accepted kind of approach to mitigating errors and improving safety in hospitals, and it's embraced by health systems all over the country. This sort of initiative, this policy initiative, is coming in the wake of a nurse named Redonda Vaught. She was a nurse in Tennessee at Vanderbilt Hospital. And she made an unintentional medication administration error that, don't get me wrong, as a nurse, she made several errors, but they were errors that were made possible by system failures and problems, system-wide problems at Vanderbilt as well. And unfortunately, and she did everything that she was supposed to do. She came forward, she voluntarily disclosed when she realized that she had made this mistake and voluntarily said, "Oh my gosh, I made this mistake. This is what happened," and did everything right in accordance with just culture. But unfortunately, she was actually criminally charged. She was charged with criminally negligent homicide and was convicted of this. And this was a year and a half ago or so, just over a year and a half ago. And this occurred with, of course, like every nurse in the nation watching during a time when nurses are immensely stretched thin because of understaffing, because of the stress and trauma from COVID. And so it's just one more thing to fear, right? Nurses are like, you got to be kidding me. Like, I'm working with bare bones staff. I don't have the support I need to do my job. And now you're telling me I could face criminally negligent homicide charges if I make a medication error, right? So it sent shockwaves through the nursing community. And so, what we would ask is that in order to preserve just culture here in Virginia, that we say, okay, when a nurse comes forward, or any clinician for that matter, because nurses are not the only, RNs are not the only people that administer meds, but if any clinician is administering a medication and they make an error, as long as they immediately upon recognizing that error, they report it in accordance with their employer's policy and come forward, that voluntary disclosure should not be admissible. It should not be used for the purpose of criminal prosecution, right? That would help to preserve just culture in that it would reduce the fears of nurses that they might be prosecuted for an unintentional mistake. It actually incentivizes them to report, because if they make an error, as long as they disclose it the second they realize it was made, right, and they follow hospital policy, that offers a bit of protection. It does not shield nurses from being fired. It doesn't shield them from being civilly sued should they make an error. And it does not mean that no nurse could ever be prosecuted for an error. It just means that it would substantially shield nurses. It means as long as they're following hospital protocol and coming forward with these mistakes, that disclosure won't be used against them. And so we think it would really just reassure a lot of nurses and would support just culture.
And again, it also creates a climate of it improves patient safety.
Oh, yeah. I mean, patient safety underlies all of this. You know, I know I'm looking at nursing workforce across my screen. So of course, like that's immediately where my brain went. But really, truly the whole point of just culture is to maintain patient safety. It's because when errors occur, they occur because a system or process was in place that allowed them to occur. And so we really rely on clinicians feeling comfortable to come forward and disclose errors so we can figure out why it happened and figure out how to prevent it from happening in the future. You know, if we don't know that errors occurred, then we can't figure out why, we can't make the system better, and that absolutely threatens patient safety moving forward. And I see Bilal, so you have your hand up.
Well, yeah, sure. I mean, what you're doing is you're creating a system of accountability, and creating that accountability. I mean, like you said, you don't have people running around fearing for their lives if they make a small error. That becomes a greater thing. You know, by having this system in place, setting a higher level of, expectations and professionalism, if you want to look at it from like an administrative standpoint. But what that ends up doing is exactly like you said. It creates a network of safety. It creates an even greater, stronger safety net for our patients and for our nurse practitioners and for our medical professionals in the event of something like this ever happening. So that's like having that accountability in place. I'm sorry. I'm surprised to hear that these aren't like I look at other industries and I look at and look at other fields, and having systems in place for accountability and that whole human resource aspect of it seems almost like a no-brainer. So I'm actually shocked to find out that these are things that don't readily exist in the medical field. So if I can ask, why has it taken so long to get to this point?
Honestly, I think it's just been the lack of a really high profile case. I mean, admittedly, these types of prosecutions are fairly rare, but when they happen, they have a major impact, right?
Sure.
I mean, along a far-reaching impact. And not only are there not any protections in place in Virginia, but actually, if you read the code about and you look at the equivalent charges would be like, involuntary manslaughter and et cetera. When you read the Virginia code, there are several little carve outs that almost point towards being able to prosecute clinicians. I mean, it's pretty intense, and I'm happy to. I've got a little policy brief on this, including the current Virginia code. I'm happy to send out to any legislators who are interested. But
I'd love to see it. I would love to see it.
Protect folks. Yeah, sure thing. I'll send it to you.
And I think one other thing, in addition to the potential for nurses to be fired as a result of errors, they can also, it's reported to the Board of Nursing, which regulates nurses. And so, as in Redonda Vaught's case, they may very well lose their license. So they may not, but depending on the situation, they may lose their license. So there is a system in place.
Yes, absolutely. This would not carte blanche just give nurses the right to make errors right and left and face no, penalty. It just means they couldn't be criminally prosecuted. They could certainly face discipline by the Board of Nursing, have their license revoked, be sued for civil damages, et cetera. And those are things we've always faced. There's some degree of, just risking those things when you enter into our practice. But criminal prosecution for a mistake at work is just not, that's untenable, I think, for many nurses. I do see Carrie Corner has, I see Carrie Corner has her hand up.
Thank you. One of the things I would add to that, not just on your own errors, but having a shame-free workplace environment to report things that you see that aren't going well, because that is not the case for many of our nurses where they're working. And I would also add, to the initial screen of your top 3 things with strengthening the nursing workforce. One that I would love to see us tackle more is the discrepancy in pay between our travel nurses and our nurses that are part of our community. I know that can be a touchy subject because if you're a traveling nurse, you like your extra money. But, if we're having a really honest conversation about the best community health that we can get, it's nurses who stay and are part of that community. If we want to talk about retention, it means that we have a unit working in a hospital that becomes a work family and they stay together. And, I look at how much money our hospitals are spending on traveling nurses, just in differential pay for one of our nurses here, it was $36 an hour she was making. The same experienced traveling nurse working with her was making $72 an hour. And she was doing it only for 1 year because then she could go back to the place where she really wanted to work and make double the pay. And it's not a fair system. And it's hurting our nurses who are part of our health systems in our communities. So I think that really has to be examined and looked at. I look at how much more money we're spending on certain people than others. And I'm not saying there isn't a place for traveling nurses, because there is. But it feels like we've almost built a system around on the backs of our nurses who have stayed part of a community. And the second piece of that, I would say, is looking at those huge discrepancies in hospital systems of nursing ratios. So just in my area, one of them, it's 1 RN to 4 patients, which is insane. And at another right down the street, it's 1 to 8. And so looking at how we start to address those staffing ratios. And, the last thing that I will say, I am all for investing in our nursing programs, and we need more nurses, but we have to retain our experienced nurses and make sure they're everywhere, because we cannot fill units with new grad students and traveling nurses and expect strong patient outcomes. So that's my soapbox for retention of experienced nurses. We spend a lot of time in the legislature talking about growing our nursing programs. And yes, that's important. But if we don't have highly qualified veteran folks who are staying in our communities, we can produce all the new nurses we want, because people will keep quitting because they're burnt out. They don't feel like they have the supports they need on their unit to become better nurses. So without those veteran nurses there, you can produce all the new grads you want. We will keep losing folks. They will keep leaving our profession because of it. So, all right, I'm done with my soapbox for veteran nurses.
Those are all really astute points. And I would just say, I really appreciate that you brought up the sort of the pay discrepancy, right, between travelers and existing nurses. And no offense intended to health systems and hospitals, but this was sort of a problem of their own doing, right? So nurse labor is reimbursed as part of room and board. Nursing care specifically is not paid for. So hospitals are incentivized to work with the bare bones number of nurses that they can, because they don't receive any more reimbursement if they work with more nurses. And so for a long time, they've worked with bare bones nurses. And pre-pandemic, it was actually, for most hospitals, it was actually cheaper to surge staff if needed and pull in travelers to fill a gap and then get rid of them after a month or two than it was to onboard and keep and retain adequate staffing throughout the year, because it costs a lot of money to orient and onboard a new nurse, right? So believe it or not, even though higher hourly pay, it was less expensive to bring in travelers. What they did not anticipate is public health crisis where there's a shortage in every state. And that's why we saw this huge escalation in payment for nurses who were burned out from never having enough staffing and very willing to leave their own hospital because they didn't feel, supported. And so it's a super complex issue. I will say quickly, we are working with the Virginia Hospital and Healthcare Association on plans to improve staffing in hospitals across Virginia. So we've been having periodic meetings with nurse leaders from every health system in the Commonwealth. And our goal is to implement come to an agreement where we can have the implementation of staffing committees committees. So committees that are comprised of at least 50% bedside nurses to evaluate the staffing situation in any given facility, with the goal of improving staffing across the board. And so we continue to work with them and are in talks with them to try to make this happen and really demonstrate some improvement to Virginia nurses. So
I gave them the same spiel. So I told them the same thing. It also helps with safety. I will say, my own sister has almost been injured several times, not just by patients, but when you work in units that people are experiencing death, people go through a lot of crazy emotions, including violence, and they had an incident and they were so short-staffed and nobody came to help them. And that's a problem. And so having those the safe staffing, it's important for patient care, but it also means there are other people in your unit who are able to help you when you can't manage something by yourself. So extremely important.
Thank you so much. And then let's see, I can't see the name, but iPhone had her hand up at some point. And so I just wanted to go back to you.
I thought I had a label, but good evening, everyone. I'm Erica Williams. I'm the president of Virginia Council of Nurse Practitioners, and I'm actually on the advisory board as well for Virginia State University Nursing Program. So this is great conversation, great topics. Nursing has been the core of me. I have been from a floor nurse to an NP. And one thing that I have learned with talking with fellow nurses and nursing students and individual nurses on the floor is they do not feel as if anyone cares anymore. And the reason they don't feel as if anyone cares, again, going back to that criminal charge, they feel as though if they make a mistake, nobody's going to protect me. I don't even want to say anything in regards to my mistake because I'm going to be charged. So they hide it. And I feel as though nursing used to be the most loyal, it still is to my eye, but the most loyal profession that anybody can to be in. I think they're always ranked number one on the loyalty as in for their job. So when nurses start to feel as though individuals no longer feel like they can be trusted, it starts to build a new type of culture. And that culture will now build fear. And then we will go into even more nursing shortage because then we're no longer going to have nursing going into nursing school because they do feel as though, why am I doing this? If I'm going to be short-staffed and then get blamed for the mistake that I made because now these healthcare facilities have not provided me with the support that I needed. So it's very important that we get laws in place to protect our nurses, especially when it becomes with criminal charges, help implement safer workplace environments, not to protect our nurses with violent patients. It's also important for us to just listen to our nurses. So when you go out there and you're, I know there's a lot of delegates, districts and senators here. When you're out there and you're meeting with these new individuals, we nurses were very involved. Ask them what will make this situation better. Ask them, how can I keep you in this role? How can I be a support to you? And those are the laws that, those are the kind of the laws that we would like for us to pass and implement. And that's all I have to say. Mm-hmm.
Thank you so much. And your name appeared all of a sudden there. You're no longer iPhone. So
I think I tried to say hello.
Yeah. Thank you.
I don't know if I got the spelling right, but it appeared. This has been great conversation. I do want to suggest, James, that we might want to move along to the next section just so that we have time to get through our platform. But this has been such good conversation. I really appreciate all your input.
Yes, yeah, definitely. Very, very good dialogue and appreciate everybody's input and questions, and it was good. I liked it. So we will go ahead, as you mentioned, and we'll go ahead and move on to our next imperative, which is increasing access to care. So all Virginians deserve the opportunity to live in a state of well-being and have equal access to safe and affordable health care. It's imperative that health equity is at the forefront of all policy decisions and that legislative solutions promote a culture of health and reduce barriers to wellness for our community members. Furthermore, we need policymakers to safeguard privacy and autonomy within the patient-provider relationship. It is imperative that the healthcare be inclusive of all patient populations, regardless of their race, ethnicity, sexual orientation, gender identity, and of course, in accordance with the Code of Ethics for Nurses. So let's turn our attention now to our K through 12 youth and the roles of the school nurse. School nurses are the frontline healthcare providers, serving as public health sentinels, overseeing the physical and mental health for all of our K through 12 students. For many youth living in or near poverty, the school nurse is the only healthcare professional that they get to see. School nurses are essential in communicable disease surveillance, identification, and intervention. And above all else, access to a school nurse is a health equity issue. It's crucial that the Commonwealth ensures that there is a nurse inside every Virginia school by implementing the recommendations of the Virginia Department of Education's 2021 study and report. Let's see here. Sorry about that. So
I think we can just open it up for some discussion if
yeah, there we go.
you just have any thoughts.
I was getting ready to say I was going to invite for more questions, but then kind of lost my train of thought there. And
I see Senator Hashmi has her hand up. You go ahead.
Well, thank you. And this question of school nurses is just so important. We certainly saw that as we hit the pandemic and saw the increased need to have medical practitioners inside our school systems. I'll just share that I've been looking closely at the NCSL proposal for a school nurse compact. It will be an interstate compact and hoping that we might be able to become signatory to that compact. That would just allow greater accessibility and transferability of credentials into Virginia, and then for any nurses who might be moving to other states. This is really impactful, especially for military families. And this is an interstate compact that's strongly supported by DoD. And so we are looking at that. I'm hoping to carry that bill, and I'm hoping that that might begin to address some of our needs for school nurses. Of course, funding is vitally important. That's a challenge that we face. Jennifer Kiggins and I I believe it was 2021, had introduced legislation to increase staffing, to increase school nurses. But we were running into headwinds with the funding model. So those are all issues that we will continue to take a look at. But I fully support having expansion and accessibility of school nurses. So I will be continuing to work on that one way or another.
Thank you so much for that. And I would just quickly say, we are expanding our potential pool of being able to pay for things like this. One of those ways is through like Medicaid reimbursement for some of the services provided by nurses. And I am not deep down in the weeds on this particular policy issue, but I know that the groups that are working on it have made significant headway in figuring out how to incorporate Medicaid reimbursement as a means to pay for this. Because as we know, many of the schools currently in Virginia that don't have a nurse present are the ones that also have the lowest average socioeconomic status, and the ones whose students probably have the highest need for having a nurse because they're less likely to see healthcare providers in other places. So anything we can do to make it work and get the dollars in the right place, we definitely want to do. And Stephen Miller Pitts, I see your hand is up.
Yeah, absolutely. And this is something that is very near and dear to my heart. Sometimes when I talk, I lost my parents and my brother to inadequate healthcare system. Growing up, we just didn't have healthcare, and I didn't know until I lost my brother in high school, right? And so definitely supporting the health and well-being of all Virginia communities, because we were in an underserved community. And part of the district, the 75th district, has some of those similar type communities that you talk about with the lower social economical status. The poverty rate in Hopewell is about 18%, and Chester is about 6%, right? So the access to the resources to healthcare is stark, and it's on about a mile and a half difference right down the road. So definitely looking for ways. And when I was a senior legislative assistant for then Delegate Lashley's area, which had some of that area, that Hopewell area, the Petersburg area, we passed Medicaid expansion to over 500,000 Virginians, right? So just making it easier access, finding the ways for those that are in different income statuses to get the same quality health care. Something that my family could have benefited from. So something that I definitely want to champion. And just understanding the disparities in some of the school systems. I sit on the Chesterfield County Public Schools Audit and Finance Committee, so having a insight on how they spend the money and the resources in the different departments, and then seeing the stark difference to the Hopewell City Schools budget, and the lack of resources that they don't have compared to, right? And then the variance in Chesterfield County from our end of it to the other more prominent ends. And so definitely want to support this because I recognize that a lot of these issues are presented singular, but it's a holistic approach when we talk about communities. When you talk about students, a lower social economic class, when they come to school, are they hungry, right? Or do they get meals, right? Do they have running water, right? Did they get a good night's rest, right? That is something separate from school and education, but it's integrated and connected, right? And like you said, the healthcare might be the school nurse's office, right? I got this rash, so on and so forth, right? Because they don't have transportation, right? Transportation is another facet, right? It's separate, but it's included, right? And so I really champion a holistic approach to get us speaking and collaborating over industries, right? I mean, then really recognizing, all right, sometimes enough is enough, because some of the conversations that we had here, the nurses on the ground is different than the people making the decisions, right? And because they're looking at different things, right? And we know this to be true, right? They're looking at the bottom line, and nurses are looking at the best care, right? And so what we need to do is get everybody together to figure out how we merge and do better for our communities. And so I'm definitely a supporter of that, because, in the military, we never had enough of anything, but we always accomplished the mission.
And, I know we have thank you so much. I know we have a couple other hands raised. I did just want to take this opportunity to mention that our foundation, the Virginia Nurses Foundation, has been very busy in the past couple of years training school nurses on youth mental health first aid. So it's really important to remember that it's not just the physical health, but it's also the behavioral health, and it needs to be an integrated approach to students. So I actually have a meeting coming up with several of the state agencies, hoping that we can be involved with the additional funding they've received to expand that to not only include school nurses in the training and the instructor training, but also have the training extend to school administrators, environmental staff, bus drivers, everyone, teachers, and possibly even students. So, and with that, I'm not sure who had their hand up first, but Bilal?
Sure. Look, if I could go and tell my school's nurse this conversation that we're having right now, she would be so freaking thrilled, right? This is it. I just saw her today because a poor child got hurt out on the football field. I had to take him inside, and it I guess it was always in the back of my mind, but never really, dawned on me. We put a lot on our school nurses. We absolutely truly do, especially now, especially coming back from COVID, from a pandemic, when so many of our kids, and I mean, I teach middle school, so I see this a lot. So many of our kids now are coming back with severe anxiety, and showing symptoms of clinical depression and are now being diagnosed with ADD and ADHD. Like, it's about this age when those diagnoses really start to, come to the forefront with these kids. So, and in a lot of these cases, kids have their medication closely monitored by one person, the school nurse. All my kids with asthma or who have migraines or have additional allergy medication and their EpiPens and all these other things, all of these things are very closely monitored by the school nurse. And I find myself now thinking, how do we foist the responsibility for 1,000 kids onto one person to manage all of their medications, all of their needs, all of their diagnoses, all of their charts, all of their this, that, and the other, and not turn around and ensure that that nurse, that person is absolutely being taken care of so that they can continue to do their job and can continue to have their support. So yeah, with my school's nurse in mind, I absolutely know that these measures and these benefits that you would like to pursue would be greatly appreciated. Not just here in Powhatan, but also when I am talking to my folks who have kids in Amelia and Nottoway, where the need is even greater. Because again, even further away from regular medical facilities, any of these initiatives that would ensure that our students are being taken care of and that our school nurses are able to do their jobs and do their jobs comfortably would be tremendously supported and appreciated.
Thank you so much. And I see Carrie Coiner, you've got your hand up next. Oh, wait, you're on mute.
Thank you. It's getting late. I would encourage us also, though, to think beyond the one nurse in each school. What I will say is, I represent Hopewell and I represent Chesterfield, and Hopewell actually has a federally qualified health center that serves for free everyone in the entire community, whether you're a student or not, but it's housed inside of our high school. And so they have nurses, they have doctors, they have dentists, they have behavioral health and pharmacy services. Transportation isn't an issue because if your child gets sick at school, they go to the doctor. We do preventive care, we do everything. So it opened almost 2 years ago. And there's also one in Petersburg as well. So if you look at in your most underserved populations and your ability to leverage that qualification because of how many people you have in poverty in that area, you have less paperwork that your nurses have to do because they're in a qualified center. And then you have sustainable funding. So, I would actually say that our students in Hopewell have a much higher access to healthcare right now than our students in Chesterfield, because you have one nurse who's trying to serve an entire student body. And yet a lot of the things that they see are things that are also things at home that they can't touch because right now they're a school employee and they can only do certain things by their contract with their schools, versus when you work for that entire health center, like at Hopewell, you are actually a community healthcare provider, and parents can come in, grandparents can come in, uncles and aunts can come in, and you can have a more holistic family care plan. And so that's one of the things we've been working with VCU. We have one of the highest rates of hypertension anywhere in the state. So we started last year a program where we're training all third graders in the entire city about hypertension, about blood pressure, and to go home and to take their grandparents and their parents' blood pressure, and then to talk to them about how you reduce it and to encourage them to come into the free clinic. Because that's the future that we want to help sort of rethink and retrain a generation to understand what results in hypertension, that results in cardiac disease, diabetes, cancer, you keep going. So I would encourage, yes, the one nurse in every school, but when we start thinking about our communities with the highest level of health needs, looking at health centers where you do have nurses as part of that team, but the nurse isn't overwhelmed with the number of needs that they have before them because they have a team around them of behavioral health, of the dentists, of everybody who's part of their team. So it's worked really well in our first 2 years in Hopewell and Petersburg. And if folks don't have them in areas where you work and you're interested in it, we would love to have you come tour our facility. It's really great.
I want to come tour your facility. My mind is blown because I legitimately did not know that existed. I'm thrilled. What an amazing asset to public health. So count me in.
Please come visit me.
That would be great.
Yeah, we
Thank
love
you
to
so
show
much.
it off. We wish more people knew, and you don't even have to live in our city. So like our dentist at our health center actually goes to school, and his family's in Chesterfield. And I was like, take the principal at your kid's elementary school flyers and let her hand them out, because it is free and open to everyone. Now, it's a benefit being in our Hopewell High School because transportation is an issue. Our schools just shuttle kids when they need, eye checkups. We check everybody's teeth. It becomes really easy. So yeah, I would love anybody who wants to come visit. Please get with me after, we can schedule that.
That really is
That's so cool.
phenomenal. I wasn't aware of it either. So Ashley, it sounds like we need to make a road trip.
Yeah.
I'm
About
in.
And James, I wanted to go ahead and turn it back to you because I know we're running over time, but we'd be really remiss if we didn't talk about our next item.
Yes. So I certainly do want to be respectful of everybody's time. I know we're running over a little bit already. So I will kind of delve into this and go as quickly as I can, but still certainly want to hit all the points and everything that we want to get across. So the next thing that I would like to discuss is advancing full practice authority. So participation in the Advanced Practice Registered Nurse, or APRN Compact, will allow advanced practice registered nurses licensed in Virginia to have greater mobility in their clinical practice, and also entice APRNs from other states to practice in Virginia, which expands access to care for residents of the Commonwealth. Participation in the compact may require the elimination of the joint boards of medicine and nursing, so the APRN practice can be appropriately regulated by the Board of Nursing. The change was recommended by the National APRN Consensus Model, as well as the Virginia Department of Health Professions, who noted in a 2021 study that Virginia is one of only 3 states burdened with the extra layer of bureaucracy. All Virginian nurses should be permitted to practice to the full scope of their education and training, just as other medical and healthcare professionals are able to do. Virginia law currently requires that nurse practitioners enter into a physician-led collaborative practice agreement for 5 years before they're eligible to apply for their autonomous license. This is the most restrictive transition period in the nation, and there is no evidence of any benefit. Many states do not require any transition period whatsoever. And among the states that do, the average is between 1 and 2 years. Similarly, with our certified registered nurse anesthetists in Virginia, they are required to practice under the supervision of a physician, despite the fact that numerous other states have no such requirement. The APRN consensus model developed by the National Council of State Boards of Nursing recommends that all APRNs be able to practice autonomously upon graduation from an accredited program. And the 2021 study of APRNs by the Virginia Department of Health Professions supported this recommendation. So I will again open up for a quick discussion and just see if anybody would like to add anything to that.
We all know I'm on Team Nurse. Every bill that y'all bring every year. It's no secret to y'all. I think I've shared it every year for the last 4 years. My primary care is a nurse practitioner. And, I switched to her from a doctor because my level of care and with her is far greater than I had with any doctor that I had had. So, I have been supportive, and I will continue to support your ability to practice to the full ability of your education and your level. So keep fighting and keep bringing those bills. So every time you bring them, I will keep advocating for them. You do great work and deserved, and we get better care. That's what I keep arguing with folks who are on, I call it Team Doctor. But I say we could have so many communities better served if people could go where they want to go and practice. And we wouldn't have such a concentrated area where doctors are tied to certain hospital systems, because that's what makes the most sense for them financially. If we could really start to break up and allow our nurses their autonomy of practice, we would really, I think, spread out to our rural areas and to some of our urban areas that need additional practitioners. So keep fighting the good fight. I'll keep supporting you all. Thank you for what you do. See.
Thank you so much. We truly appreciate your support, for sure.
For sure.
All right, Bilal, I think I see
Yeah, no, I'll be super quick about it. We've mentioned several times we are severely understaffed, and the nurses we do have are overworked. The last thing we want to do is continue insisting on arbitrary draconian restrictions that are not doing anything more than just delaying the process and artificially extending the process that our professionals, that are educated, well-versed professionals, the hoops they have to jump through to do their jobs. This doesn't say we lower our standards for who we're looking for in our medical professionals. This is saying let's recognize that those standards have already been met, if not exceeded. Why waste their time and ours, which in the medical field, time is vital. Everything is measured by the second. Why are we wasting it pushing extra paperwork onto these folks? Let's absolutely get people where we need them the most and stop holding up this process that needs to be pushed forward. So yeah, 100%.
Thank you so much. Truly appreciate it. Anybody else want to chime in on full practice authority or have questions about it that we can answer for you? Or
I think the only thing I would add for Carrie is that one of the concerns I think we've heard from Team Doctor in the past is that this would expand nurses' scope of practice. And it by no means expands the scope of practice. So that can be taken off the table. There have also been discussions in the past about, well, they want to work autonomously. They don't want to collaborate. Not true. So, I mean, our healthcare model doesn't work that way. And nurses will always be great collaborators, but we appreciate both your support on this. It's such an important issue. And to us, it's just common sense.
for sure. And Carrie had to step off because she had to go pick up her daughter from her high school volunteering or something. So she didn't hear that part, but I'm sure that she would appreciate it. Let's see. I do see, is it Nathan McKenzie?
It's Nate Tan. Everyone throws the H in there, even autocorrect. So I don't hold it against you whatsoever, Ashley. It's all good.
Thank you.
Well, I will take this opportunity to not only expand on the common sense of what we're discussing right here, but also throughout this entire conversation. This has been a very informative dialogue, but most importantly, I think this is very productive for us to understand what you're dealing with on the ground level and how we can bring that to the General Assembly for I won't say the whole host of issues, but the opportunities that we talked about, right? I was very much educated when it came to the surgical smoke. Definitely when it comes to the just culture as well. But also this particular issue of the common sense of simply being able to expand what areas of practice that are needed, especially when we're dealing with a exodus, let's just say, of nurses and a shortage across the board. You would assume naturally that Team Doctor would be thrilled to have individuals to support them in those various areas, but whatever the case might be, we'll sell that in the General Assembly come January. But what I will ask is that as you guys are continuously doing this, be sure to ensure that us legislators are being held accountable to these initiatives, right? I will be the first one to tell you that it's great to have this conversation now, but it's even more important for us to have it a few months from now when we're really discussing with our colleagues. And unfortunately, if they're not exposed to the scope of the impacts of some of these conversations, they're not going to take it as seriously as they should, unfortunately. And so I just want to, commend you all for continuously doing this work outside of your already grueling, 12 to 12 hours that you may be putting in these days. But I also want to empower you to know that your work is definitely not underappreciated and very much felt for all the patients that you've touched, but also your coworkers, the doctors, and the communities at large. So thank you for everything.
Thank you.
Thank you so much. And hey, when the legislative session comes around, you want to advocate to, other legislators about our policy, I will give you all the data you need. I will get you some, cheat sheets, some bullet points on like how to address, any potential, opposition that you might encounter for it. So you let me know. I got the data for you.
Say less, Ashley. I appreciate you.
And I see Deborah Gardner has her hand up.
Yes. I just kind of want to say thank you so much. This has been really informative to me. I know I've been really quiet. I actually had an excellent nurse who gave me my COVID and flu shot yesterday, so I'm moving really, really slow today. So that's why I am still trying to keep myself focused to hear what you have to say, but this is really good stuff. And I look forward to talking with you and hearing your priorities a little bit more. Thanks.
Thanks so
Thank
much.
you so much. And listen, you can totally take Tylenol or Motrin. It's okay. It won't decrease the efficacy of your vaccines, and drink plenty of water. And I feel your pain. I got my flu shot yesterday.
I've been drinking the water, but she told me the opposite. She said, well, you might not want to do that, take something. And so I think now it's been a whole day. I think I need to go take something. So thank you for
absolutely
giving me
can.
permission.
You absolutely can, 100%.
Yeah, the evidence shows, the evidence does not recommend pre-medicating before vaccination with a Tylenol or Motrin. But if you develop symptoms afterwards, there's no evidence to suggest that it will impair your immune response to the vaccine. So the latest and greatest, you heard it here. You can totally take it.
I can see you're headed to the medicine cabinet now.
Yeah.
I surely am. Thank you for that.
You're welcome. All right, and let's see. I see Stephen Miller Pitts with his hand up.
Yeah, myself just echo the same sentiments. This has been very informative, and I'm excited to push these initiatives in the General Assembly. Look, here's the thing. I just think that we need legislators that understand all facets and want to work for the people, and solely the people. And so we can use word jargon and do some gymnastics with wordplay, but the truth of the matter is not everybody has the influence to get other legislators on board within to do these things that you all need done. Because if they could, you wouldn't be talking about these things, right? And so the reality is we have a unique opportunity to do some innovative things to where I believe we should reimagine the whole healthcare system, right? I think it's fine to teach these students at a young age how to treat symptoms, but we really need people to stop having these symptoms, right? Because when we really think about how the healthcare system got overloaded and all this fatigue is because it wasn't prepared for the influx that happened over a constrained time period, right? And so then everybody got burned out, and then the nasty came out of people, and then you have all these variant things because the support was really never there, because the top people want to make all the money. And when you keep people on certain things, they continue to come get services. And then the people that actually care about the patients are left holding the bag, literally. And so I just want you to know that I am a holistic champion, not only for you all, but for the communities to kind of fix a lot of these systemic things instead of putting Band-Aids on wounds. And so I hope to be working with you very soon.
That's fantastic. Thank you so much. And what you're talking about is like primary prevention, right? And dealing with the social determinants of health and making sure that we prevent major problems before they happen, and doing things like funding public health and, and whatnot. And so anyway, I truly appreciate your your sentiment and your support. Awesome.
James, I don't see any other questions, so we'll throw it back to you.
All righty. So, again, like I said at the very beginning, I know everybody is super, super busy with, preparing for elections and you've obviously, got jobs and lives and things outside of this. So again, truly appreciate everybody coming out and listening to what we have to say. So just kind of, as we wrap everything up, just want to remind all of the nurses and nursing students, nurse practitioners that may be here, that we need to actively engage in the democratic process if we want to bring about the changes that we've discussed. Getting out there voting reaching out to legislators, telling personal stories, experiences, which can really act as a catalyst for change. And legislators often want to hear from you. So reach out to them before the start of the General Assembly in January, and be sure to join us at the Capitol in Richmond on January 18th for our lobby day. And also plan to join us virtually on November 15th for the annual legislative summit, and registration for that summit is currently open. So I just want to thank everybody again, and as you're all out getting your flu and COVID shots, stay healthy and stay safe, and we really appreciate you being here with us tonight.
Thank you, James. Great discussion. Thank you, everyone.
Thank you so much, and I look forward to seeing everybody when the session happens, and we're gonna make some changes this year.
Let's do it.
Looking
Awesome.
forward to it. Everyone have a great night.
Thank you all for having us.
Thank you.